Southern Nevada District 3 president of the Nevada Nurse Association. So you may see me around the internet in a lot of different hats. And I love mentoring our students, and this is one great way that we're doing that. And today, my goal is really to help you demystify the NCLEX in the NGN, the next generation NCLEX, some of the changes, give you some strategies that's going to help you hopefully be logical in your test taking strategies, but also calm, because you know we get there, we get all stressed out. And most important, give you confidence so that you can pass your NCLEX. So let's just take a quick look at some of the changes and help you understand the new next generation NCLEX. First of all, it is your pathway, right, to your nursing career, to your nursing profession. And if you can't pass that, you can do all the schooling that you want, but if you can't pass that exam, then you can't go on into develop your professional career. So the biggest thing that we want to understand is, what is the NCLEX for? A lot of times in the past, NCLEX was testing your knowledge. But it's not only testing your knowledge, it now has changed. The next gen format has changed not only to test your knowledge, but how do you think as a nurse? Are you able to apply clinical judgment and decision making to different nursing scenarios? So it really tries to mirror that. And one of the reasons that they changed the NCLEX format is because they reached out to a lot of the workforce, different research groups, and they found out that nurses were not prepared when they came out. They were recalling and doing memorized, but they couldn't really apply judgment or decision making. And so now it is really focused on that. So we're going to talk a little bit about the model that we will be using for that. And then they also have new questions, different questions and things that you may be seeing on there. And some of those which we'll go into, or they have case studies now that you unfold in case studies. They have drop boxes, they have matrices, they have these little bow tie decision-making things. But all of those are not only to test what you know, but what are the decision-making process? How do you think? Do you know the rationale behind those? And I'll show you some of those examples as we go through. But just understand that this is a new format. And as a matter of fact, let me just kind of show you a couple of these. So usually when they had the NCLEX, you may have multiple choice, you may have SATA, which are the select all that apply, but now they have formats where they're going to give you a case scenario, they're going to give you some selections, and these are in different formats. It might be in this format, which is basically select which one you're going to use. And what we're going to talk about a little bit later on is, as you're reading these, looking for what exactly they're asking for. Because based off of those is how that format is. So this particular one is looking for an immediate follow-up. So they're looking for a priority type question. But the case studies can come in different forms. You may have just checking the checkbox. Now, instead of just the multiple choice, you're going to see, maybe they want you to be consistent in telling us what it is about that particular disease process. So it's not about just recalling the information. It's really, you have to really understand the differences between those. They also have some drop boxes. So they'll give you a case study. You can have some drop boxes. They'll give you maybe some medical records, some vital sign, nursing notes to go through. But this is just one, let me see, that you can pull down, and you'll have the different pull down. They also have some different fill in the blanks around the same scenario. So this is one where you're looking, it's a case study, but it's looking at what's indicated and what's not indicated. So going and taking these individually is not a memorization. You actually have to understand, okay, do I really understand what it is that I'm reading? So those are just a few. And then they will give you, maybe they give you doctor's orders. So you have a scenario with a timeline. You're going through your reasoning. You may have some physician orders, and then through that, you're going to make some judgments or some decisions based off of that. You may have to, this is a case one where you have to highlight the different priorities. The doctor gave you a whole bunch of orders. Which one are you going to focus on? So as you can see, there's a lot of different varieties. This one is a case study, and all these are sepsis, around sepsis, but they're using different ones. This condition, you're going to do if it's improved. Has the condition changed? Has the condition worsened? But these are things that you actually have to know. They also may have it unfolding, meaning you may start with a situation, and then based off of your decisions that you input, it's going to give you another scenario, and then you're going to have to make decisions based off of those decisions. It's what we call those unfolding case studies. So all of these are some different, I think I've seen that one. Here's a different one. These are some standalone examples. You still may get a case study, but they may give you some specific nurses' notes, and then they want you to fill in the words or fill in the different word choices. Sometimes it's just fill in the blank. And then we have these bow tie ones. And these, again, they're testing not only your decision making, do you understand what you're doing, the rationales behind what you're doing, and then the possible outcomes. And so for this particular one, you're going to drag your choices over into the column based off of that scenario, and you see most is highlighted. You're going to choose two different actions. Based off of that, what are the two actions that you would prioritize and take? And then off of that, these are, the middle one is the condition most likely that you're going to experience. So what symptoms would you see that this patient would have? And then what are the things you want to monitor? What are the outcomes that you're going to be looking for to know if you even have improvement or not? And so you're going to pull those. And so you basically just drag them and drop them into the spots. And this is really different from what our NCLEX has been in the past. We've really just had to, put a little, I can guess 4 out of 5, in your multiple choice, but this is really making you, oh my goodness, I have to actually think. I have to actually go through the critical thinking process. So in this critical thinking process, this is the clinical judgment model. So most of you, if you're in most of the schools now, colleges, have really adapted this into their practices. So you should be seeing these on exams that you're taking. So you should hopefully have seen some of these examples. Exams, a lot of the schools should have adapted that process. They want you to test like you're going to be testing for your NCLEX. And so the clinical judgment model, let me see if I can get to it, find my page here. This is really, you know how we used to use ADPI or the nursing process? It's the same, but they gave you some different names. The process is still there, the process is still the same, but we gave you them. The clinical judgment model looks at, can you recognize cues? Can you identify important patient information? From that case study that I gave you, what are things that's going to trigger you that, oh my gosh, I need to do something? What are the things that I need to act on? Is it a fever? Was it heart rate? What was those actions that I saw that made me feel that I needed to take action on something? And then once you have that information, you want to analyze the cues. So we collect data, right? We're collecting data constantly, but you need to determine, okay, what does this mean? If I see a person with VTAC and having a arrhythmia and they're not symptomatic, do I act? Do I need to go do something, or am I going to sit there and wait? And I'll wait till the doctor make a round and then I'm going to call. So those are the things that you want to look at. What are you going to do with the information? And then you want to prioritize your different hypotheses in that, okay, what are likely problems? This is where it used to be the nursing diagnosis. So what are things that could be wrong with this person? Is it fluid electrolyte imbalances? That's what's causing their heart to be abnormally and making all these funny rhythms? Is it something structurally going on with their heart? Is it something? So you want to identify what is the actual problem, and then based off of those, this is where we come up with our different solutions. As a nurse, what am I going to do with this patient? Do I need to monitor your respiratory? Do I need to take action? Do I need to get a pharmacy order? Do I need to call the doctor and say, hey, do you want to, this hemoglobin is 5. Do you want to recheck it? Do you want to get some blood? What do you want to do? Those are the things you want to do to generate the solutions for it. And where a lot of us fail, and I still do sometimes, I'm just trying not to do it as much, is review medical charts as a legal nurse consultant. And where I've seen people is they can do all, they can recognize the cues, they analyze it, they get all the information and figure out, but they fail to take action. What is it that you are going to do to implement the best thing? So if my patient is in VTAC, I need to be going to get students, if they're asymptomatic, symptomatic, I need to be going to grab a crash car. If they're going out, I need to be doing CPR, letting somebody know something versus going back up to the desk and, well, I'm gonna call the doctor and he'll be around in a short minute. So taking action is going to be your biggest thing that you need to do. And you need to be making sure that you're documenting those actions. And like any process, once we've done that, once we've taken the action, we need to make sure that we are evaluating the outcomes. How do we know it worked? How do we know what we put into place has worked? If it hasn't worked, what are we doing about it? A lot of times, we may give a medication and we fail to go back and monitor if it worked. We fixed it, we gave them some medicine, it's done. But if they're still having issues, you gotta go back and generate some more solutions. What else do I need to do with this patient in order to get them the outcomes that I'm hoping to achieve? So this is the clinical judgment model, and this is the foundation of what your NCLEX is based off of. So once you kind of put this into everything you do, and I usually give my students, there's a little handout, and I'll get that and I'll send it out to your folks. And it goes through these, and it has questions. If I'm gonna recognize cues, it has 5 or 6 questions. What should you be asking to recognize the cues? What are the things that you need to be doing to analyze that? So I'll send that out to your group and start to just implement this. When you're studying, ask those questions. Just go through the process, and that will also help you start to make this just a daily practice, a habit. Now, one of the things that you do need to know is if you are taking the NCLEX, there are 8 areas, what we call high yield NCLEX content areas. These are the things that we know, for the most part, are heavily tested. We see them a lot. And so these are the areas that you want to focus on as you are doing your NCLEX review and study. I'm going to kind of go through these. I think I got them individually, but let's take a look. The first one is management of care, and that is anything around prioritization, anything around delegation. And when we say delegation, that's RN versus LPN versus CNA or any unlicensed assistant personnel. You need to understand what are the differences, what are the legal and ethical issues of those. So management of care focuses heavily on those areas, and you see that a lot through NCLEX. The second one is safety and infection. Even though a lot of times we think, okay, we got the safety and infection piece of it, you need to know your isolation types. You need to know how to prevent those protocols. And if you need to, use mnemonics. This is one that I use for how do you know which ones are airborne versus which ones are droplet. And so that would be my chicken, and has is spelled H-E-Z. I don't know why they put that. Hepatitis zoster, I guess. But my chicken has TB, and that's to help you think measles, chickenpox, herpes, and TB are the ones that go on airborne precaution. So use mnemonics as much as you can to just help you remember those type of things, because that's where a lot of people get confused. The other heavy area is pharmacology. Whew, Lord, pharmacology. But pharmacology, the biggest ones to remember, you always want to think anything that's high risk meds, they're going to test you on those. Your heparins, your insulins, your warfarins, your DIGs, your opioids, anything that a person has the potential to be harmed because of, too much or too little, you need to make sure that you're focusing on those. So focus on the high risk. Example, in the detail that you need to know on those is like, for example, like your low potassium, what does that do with your DIG toxicity levels, right? You can get bradycardia, you can have nausea, but you may not connect those dots. So that's some of the things that you're going to have to get into the weed and understand your high risk and what impact does that have on your patient. The other category is health and promotion maintenance, and that's a lot around focusing on your milestones, different preventative screenings, reproductive health, like your prenatal, postpartum care, aging, and process. So think of any of your infant benchmarks, like your milestones. Know your milestones and your developmental stages. They're going to test you on those. Vaccination schedules, different screenings for like breast, colon, and prostate. Again, this is under the health promotion. So that's a lot of times, these are the ones that people are more weak in. They can give you the disease, but they can't, it's these that are ones that are kind of heavy, that people don't really get all the time. And then basic care and comfort, pain management, nutrition, hygiene, sleep, mobility, skin integrity. Know your pain scales and your nutrition, especially for special populations. Like if you got renal, diabetes, cardiovascular, nutrition, they're gonna test you on it. And nutrition is gonna be like, what is your, they're gonna give you food and say, what is the best food for this particular patient? They're not gonna ask you, like just a simple question. You have to understand the foods and what they relate to. Mobility, positioning, pressure ulcer, and prevention staging. That is another one that they're going to focus on. And then the last three areas, anything psychosocial, integrity, therapeutic communication, any of those mental health. I feel hopeless. Somebody says, I feel hopeless. What are you going to say to them? Okay, well, you just go and take care of that. So you want to explore. Tell me more about how you're feeling. So they're going to ask you that and put you in the situation, and you need to understand how would you respond. And if communication, because a lot of people, communication is not their strong point. They may not know what to say for a person in that particular case. And so sometimes they don't say anything, but that could just cause as much harm. So you want to make sure that you understand that. Physiological adaptation is the other high yield content area. And these are around like any of your chronic diseases and emergencies. Those are the ones, your diseases that you're trying to memorize. Those are the ones that you need. Like a burn patient. What's important about burn patients? They're losing their skin. They're gonna have fluid electrolyte. Their potassium, the dehydration. You have to understand how does that relate to that. And reduction risk, anything reduction risk, which is anywhere there's a complication that can be had, procedures, devices. You need to know your devices. You need to know complications that can have. For instance, if I have a chest tube and I see continuous bubbling, what does that mean? What am I supposed to be doing something? Or am I just kind of saying, okay, that means he's breathing? I don't know. So those are higher. So those are the 8 areas that you really want to focus at. And then as you're thinking these, always think critical thinking frameworks. And I know this is a little tinier slide, but I was trying to put it all on the same thing. But a lot of times people get confused on how do I know which one is, when I'm thinking priority, how am I going to, if I have a question, how do I know which one comes first? So these are just some frameworks to help you. So with the ABC framework, we're always going to say airways, always start with your airway, breathing, and circulation. All right, those are going to be the ABC framework in that order as far as priority. And then you have Maslow's hierarchy. So for Maslow's hierarchy, you also want to make sure you're starting with a person's physiological needs first. For instance, if I'm homeless, I ain't got no house, I'm not trying to hear anything you're telling me about getting medications or anything else, because that's a physiological need that has not been met. So that, and then safety would be your second one. And then you can start with any of your psychosocial.
That's
The pyramid, it is a pyramid. And I started to stick that there. I knew it was something else. That's probably what I meant to put there. But yes, that is your pyramid. So remember, it's from the bottom up. So remember, if you're getting confused on, okay, all of these look like they're right answers. And all of them could be right answers. But use these frameworks. And then ACPI, or your clinical judgment type framework, which is your nursing process. You got to assess before you intervene, right? You got to plan something before you can evaluate. So use these frameworks to also help you in that thought process. All right, how you guys doing?
Good.
All right, good deal.
I feel like I'm back in school though.
Now, I do want to back up for 1 second and just tell you, because I missed this on my little thing here for my high yield, but I want to tell you for your high yield questions, for the management of care, usually it's 17 to 23% of questions are around that. And then under your safety and infection, it's usually 9 to 15% of the questions that are on that.
Can you read the first one? Management of care, 17. What was it? 17?
The first one, I can't remember what I said. Hold on. 17 to 23%. And then safety and infection is 9 to 15%. Your pharmacological, usually 12 to 18%. Management of care is 17 to 23. What did I just say that one?
You said 17.
Okay, let's say it again. Health and promotion, 6 to 12%. Basic comfort and care is about 6 to 12%. And then your psychosocial is about the same, 6 to 12. And physiological is 11 to 17. So, I mean, that can kind of also help you as far as how you prioritize your studying. I think that was the last one. All right. So hopefully that'll help you as far as helping you focus on those areas. Now, I'm just going to quickly, I know as far as time-wise, these are under each one of those high priority areas of what a question would look like if they were going to ask it. So if I were going to look at something around prioritization and delegation, this might be the example. I'm giving you 4 patients. Which task can I delegate to a CNA or vice versa? Y'all know which one that one is?
C.
Everybody with C?
Yeah.
The answer is C, because they can help with ambulation, but they can't do any assessments, can't do meds, and can't do evaluations. If you were going to do something on safety and infection, like isolation, anything air or fall risk, it may look, again, this is the question about the airborne. All right, do y'all remember our mnemonic?
BC.
It is C, but
It is C.
It is C, because my chicken ass TB. I was just testing to make sure y'all remember that. All right, and pharmacology, again, you need to know the ranges, and usually they will provide you a range. So you want to provide, but you should still, most ranges are only going to be off by 1 or 2 depending on what you use. It shouldn't be way off. So you should have a range that you remember. So if I had a patient here that was on DIG and had nausea, vision changes, and a heart rate of 50, which lab value is going to be most concerning?
not glucose, not sodium.
Potassium or sodium.
Potassium?
Okay, everybody with potassium?
Yeah, that's my first choice.
Normal potassium should be around 3.5, 4.5. And so hypokalemia increases the risk of DIG toxicity and can also have other heart, diabetic, it can cause all kinds of issues. So we really try to jump on those quick. Now, if you were doing something health and promotion, remember this is the one I said you need to know your developmental stages. You need to know your aging process. So if I had, if I had a 9-month-old baby, they should be able to do what?
Ew. No, I'm just kidding. B.
Hey, 9-month-old baby stacking blocks, I'm going to be shocked.
They should be able to crawl, respond to name. And I'm a new grandma, and so she's actually a year old, but she loves peekaboo. And I'm like, she was doing it really early, and she's been just playing that little game. But these are the things that you want to look for. So you need to use your developmental milestone charts, and you need to review those so that you know those, because I promise you, you will see those again. Psychosocial, this is where that mental health and how are you going to respond. So you had a depressed patient say, I don't want to live anymore. What's going to be your best response? Yes, tell me more about how you're feeling, because it's open-ended and it allows them to give you more explore on that one. Physiological, this is the part where you need to know your the physiological component of your disease process. So if you got a patient with a head injury and all of a sudden you see them have a drop in their level of consciousness and you see a widened pulse pressure, what should you suspect? You should suspect intracranial pressure. So if you have a widened pulse pressure, what y'all remember what widened pulse pressure is? You have your blood pressure is high and your BP is low, that long gap there. If you have that and you get a decreased level of consciousness, you should start to think that you're having increased pressure. You should also know the early signs versus late signs, because what they're going to give you is signs and symptoms, and then you're going to determine, is that a late sign, is that an early sign? So make sure that you know those. Comfort and care, patient refused to ambulate post-op due to pain. What should you do first? And again, this is basic care and comfort. So if you need to use your some of your frameworks to look at that, which one would you do first?
B.
A patient refuses to ambulate post-op due to pain. What would you do first?
I'll treat the pain.
So this will be where you can use your ADPI. Good. You know, you want to assess before you figure out what's going on. Before you figure that out, you want to plan, intervene. So you want to put those. So you would want to address the barrier first. What is in this particular case, it is the pain. That's the reason why she doesn't want to do it. And then the last one category, remember, was reduction of risk potential. This is the one with the chest tube finding is abnormal. Which one of these is abnormal for a chest tube?
You said bubbling.
The continuous bubbling. See, I'm just testing to see y'all listen. Continuous bubbling is bad. Air leak, bad. So know your devices. If they got a JP drain, if they got a Foley, if they got any type of drain or device, you want to understand how it's supposed to work, and then how do you know that there's a complication or something's not working. All right, so for those who are taking the NCLEX, one thing we get a lot of questions on is computer adaptive testing. So that's pretty much what your NCLEX does. You take the test and it will adapt based off of your performance. So you can get a lot of questions or you get a minimum of questions. Usually I think you can get a minimum of 85 now, and 150 is the max. But just because you get 85, and then they cut it off, that just says they have enough data to be able to tell how well you're performing on that. Usually if they see that you're doing the exam and then you get a little bit, maybe you were struggling a little bit, they give you a little bit more questions just so they can make that determination. Okay, we don't really have, because they have a standard passing cutoff, and maybe they just don't have enough data in order to get a 95% confidence level that you are meeting those passing standards. So that is what that entails. And this one says 75 and 145. They did have, it used to be 75 and 145, but they've changed it to 80 and 150. So pretty much that's what computer adaptive is. And I I think my last things here. Any questions on that piece of it? Okay, test taking strategy. These are my last little strategies before I'm letting y'all go. When you are doing your test taking, the first thing that you want to do is make sure that you are reading step-by-step approach. You know, just use the same approach every single time. You want to read the question first, reading the stem of the question. What is it asking you? And then from there, you need to look for those keywords. And sometimes that means you need to highlight it. Is it saying priority? Is it saying initial? Is it saying not indicated? I mean, not. So you need to look at those keywords. And then you want to go response by response and eliminate at least the wrong answers. And a lot of times people second guess themselves. A lot of times that gut feeling you go through is probably the correct answer. But then you'll go through it and then you will second guess yourself, or you'll reread it and double read it and triple read it. And then by the time you finish, you don't change your answer 50 times. And that probably was the right answer, the first place that you have. So you want to make sure that you are identifying the STEM. What is it asking you? Priority words first, best, most appropriately. Anytime it says never, what's the other word? Always, any of those words, because it's never and ever going to be 100%. So you can go ahead and eliminate those. Now, the biggest ones that most people, eliminate things also if it's unsafe, if it's outside the RN scope, you can go ahead and eliminate those. And if it's irrelevant at all to the scenario, you need to go ahead and eliminate those. Now, the ones that most people have issues with are the SATA. Select all that apply. Because sometimes you leave them and be like, oh man, all of these are correct. So the best thing to do with your SATA is go one by one and treat each one of those like it's a true-false question. So ask yourself the question, is it true? Is it false? If it's false, you can just knock that one out. Don't look for patterns, because a lot of people look for patterns, like it's the right number, like there's got to be 5 answers or 4 answers or 3 answers. That is out the window. You just work the questions, each individual one, and then you want to verify each option independently. Don't look at that based off of what the first 2 answers were or the second 2 answers. You want to look at each one independently. Put an example here. For diabetes teaching, insulin with the blood glucose level below 70 and skipping meals are unsafe options. Correct. So you can just eliminate those altogether if it was a select all that apply. So that would be a good strategy for you for that one. All right. Any questions on that? Good deal. All right. I think I already did some practice tests for you guys, but I do want to just look at a couple things. So like on this one right here, and we're not really good. You see how it says which nursing intervention is the highest priority? Those are those key things that you want to focus on, because all of them are great priority for a person who's having an allergic reaction. All of those are great, but you want to look at those highest priority. Let me see if there's another one. This one is a select all that apply. So looking at what we just talked about for SATA, the nurse is assessing a client receiving DIG. Which findings would suggest possible DIG toxicity? Oh, the answer there.
I'm like that.
Okay. But anyway, so if it was nausea, you would ask yourself, does nausea go with DIG toxicity? So that would be, diplopia. You would go through each one. Diplopia, if you ask that, diplopia doesn't go with it, but the green halo and the visual disturbances do go with it. So they gave you 2 that's possibly answer, but if you put it in that true false, you would know that the yellow green halos is the one that's most common with the DIG toxicity. All right, and we talked about the chest tube, talked about therapeutic energy. All right. Now, the last few things I would talk to you about is, guys, you gotta take care of yourself for you have to go into the exam with the right mindset. You can't go in there, oh my God, you're gonna fail. Because if you say that, you're gonna fail. But if you go in there, I know I studied hard, I worked hard for this, I know this information, then you go in there with that positive mindset, and you have to believe in your own ability, and you will succeed. So any of that negative self-talk that you have to yourself, and if you have to, put the mirror up and put you a couple of affirmations that you say in the morning before you go to work, but that is going to help you focus on your strengths and not your weaknesses, okay? The next thing is sleep. Ain't no need of trying to cram before the exam, because if you don't know it by then, you don't know it. And I'll tell you, when I did my exam, and I was the last class, guys, the last class to do the hand, just tell you how old I am, the paper and pencil, and it was a 2-day exam. We had to say, yes, 2 days, and it was like an all-day thing. And I had to travel an hour and a half to Columbia, South Carolina to take my exam. But when I did that Friday when I went up, I did not study, I got me a massage, I got through my nails and things done, and I refused to pick up a book, and I refused to look in it because, one, I didn't want to stress myself. Two, my mindset was I either know it or I don't know it. So take some time and get enough rest, relaxation. You need 7 to 9 hours of quality sleep in order to optimize learning, because it helps you retain the information, but it also helps you reduce stress. And if you have to, get some stress-reducing strategies like meditation or breath work or do some yoga, but get you something in there to trigger, because a lot of people before exams, they have a lot of anxiety and a lot of stress. So this will help you to relieve that. And don't forget about eating your food. Eat a breakfast. Some people are like, I'm not eating breakfast, but your body needs that food in order to feed your brain so that you can recall all this information. And so healthy eating habits fuel your brain, but it also gives you energy. It gives you that energy, for long study periods that you might have, but also just to get through those exams. And the good thing, guys, celebrate the small wins, even when you don't celebrate your achievements, because a lot of people, like you say, don't get this far. And so you need to celebrate those no matter how small they are. And when you do that, that will also help you build your own confidence up. And the other one I had in here was take breaks, because some people try to study for 5, 6, 7, 8 hours. You need to take short, frequent breaks. It'll help you with your burnout, but it also helps you to remember your information. So again, preparing for NCLEX is not only about the book study, but it's also about taking care of your own mentally, social, and emotional, physical needs. All right, and then I think this is my last slide. So there are a lot of resources that are out there. I know here at our school, we focus on ATI resources. That is what we use as our content theory, so they have a lot of resources. But there's also some other ones out there like Archer, NCLEX, UWorld, Kaplan. I think there's either High Yield. So there's a couple of them out there. So what I would say is find one and focus on it. Don't be skipping all over the place, and don't be spending all that money skipping all over the place, because again, it's your study habits and how you study that's going to help you through this particular portion of the exam. And you need to kind of develop you a routine. I think I have let me just make sure it's on the slide. Oh, no, more. All right, so on the other thing I'm gonna say is when you're studying, make sure that you have a plan for your study, because you can have all of these resources and they don't help you if you don't have a good study plan. So what I recommend is that you do 25 to 50 questions a day. Every day. Just do them because, and this is not looking at spending time just reviewing, you spend time reviewing the rationales, but not just the ones that you got right. You also want to look at why is it wrong? What are the questions that you answer, the rationale, and why is it wrong? You want to mix your content up with content days, mix those with question days. So if I'm studying content, I want to also include some question days in there. So a example flow might be, let's see, I'm not making you study all day, but this was a 9 a.m. Maybe I'm studying 25 questions. Maybe at 10 I'm going to review the rationales. Maybe at 12 I'm going to do some pharmacology flashcards. And maybe 2 I'm going to have a group discussion or solo review. You just need to have a plan. No matter how long you make the plan, you just need to have a consistent study plan. Okay? And I think that's all I have for you. So
Thank you.
hopefully that will help get you through it. What questions or things that was mud is clear as mud.
So for LPNs, because I think we have an LPN grad, I know they gotta do the NCLEX too. So for them, what other focus should they do? Like I know it's been 5,000 years by the time I did my LPN, because I did LPN to RN, but
I think, so when I was doing this, I pulled content from the RN and practical nursing. I think the content areas are the same content areas, but it's more so on scope of practice versus it is the content area. I mean, there's still content, but that's really kind of the only difference in those. So just make sure, but there's a lot of the same focus areas, the same disease processes, and I would definitely still use the same strategies for taking it and for studying for it.